Hello and good evening. I'm Melisa Idris. Welcome to Consider This. This is the show where we want you to consider and then reconsider what you know of the news of the day. As I'm sure you know, Malaysia's healthcare system is undergoing strain. Healthcare costs are rising, hospitals are increasingly congested, and doctors warn that the system is approaching a breaking point. As policymakers debate healthcare financing and service delivery, questions are now growing about whether Malaysia's healthcare system is optimised for prevention and quality primary care. So joining me on the show to discuss all of this further is Datuk Dr Thirunavukarasu Rajoo, who is the president of the Malaysian Medical Association, which is the main representative body for all registered medical practitioners in Malaysia. Dr. Rasu, welcome to the show. It's good of you to join me. Thank you so much for being here today. I know there's so much for us to cover, but I really am quite curious to know your assessment, your diagnosis of the problem, how you see the current state of Malaysia's healthcare system currently. I think the reason why I'm asking is that a lot of people are characterizing this as being in a state of crisis, reaching a breaking point. Would you agree with that assessment?
First of all, thanks Melisa and also Astro AWANI for having me here. Okay, you asked a very, very important question, but I have to answer it very carefully. Okay, because the word crisis may give a different connotation to the public as well. But one thing we need to acknowledge, if we are not careful, definitely we'll go into a crisis.
Okay. So we are at the cusp of it? Are we approaching that worrying level?
We are at the worrying level because why? One thing we must understand that the system has delivered a great deal for relatively modest spending all these years. Because if you look at the system historically, in the 60s and 70s, we had different issues. Maternal mortality and infant mortality. Mothers are dying after birth and babies are dying, right? So we managed to address those issues very well in the early 80s and 90s. Okay, so it has served the purpose. So now the question is that the system that was supposed to serve that purpose has served. Can the same methodology can be used for the current disease burden, technologies, aging population, the complication of NCDs?
Okay.
So now the funding.
There are contemporary problems that the healthcare system may not be optimized to deal with. Let's talk about one of the key issues is the rising cost of healthcare, cost pressures. Where do you see, or what do you see as the key drivers behind rising costs?
Okay, if you look at the rising cost, right, number one, we have to look at the disease burden. That means the types of diseases currently we are facing. We have seen that the non-communicable diseases like diabetes, hypertension and cholesterol is on the rise. Obesity is on the rise. We know Malaysia is the number one leading in Southeast Asia, right? And then we can see the number of diabetic cases are on the rise, even among children. And then if you don't take care of yourself, from pre-illness you become illness, and then you don't take care, you go into complications. That's where the cost shoots up. Okay, you got multiple organs are affected, so the cost shoots up. That's one thing. And then we also have aging population. So when you have people who fall sick early, when they age, to maintain yourself in terms of your health system, your body is also going to be expensive. And plus technology is on the rise, right? So all these things are compounding factors why the cost is going up. So that is why now the question is that, and we also underspending.
Okay, so you're talking about the fact that demand on healthcare services has been increasing.
Yes.
Where do you see the drivers for cost pressures on the supply side?
Okay, if you look at the supply side, of course, who is delivering the care, right? Number one, you need a facility. And then from the facility, you have equipments to manage to deliver the care. And then you have workforce, manpower. Okay, we are understaffed, we are overworked in the public sector. I'm talking about the public sector.
Yes,
public sector. So definitely, the demand has increased, and those people who are providing the services are also a lot of stress. So definitely, you need to manage it holistically. So the key, while the cost has gone up, but the key people who are managing the healthcare system, the healthcare workforce. Okay, we really have to take care of them. We have to take care of the people, the workforce who's taking care of the nation. So that is very, very important.
What are your members telling you? So you represent, you're the main representative body of all of medical professionals. What are they telling you? What are you hearing about how best to take care of them?
Okay, how best to take care of them is a very good question. Okay, number one, of course they need a work-life balance as well. Okay, if you're talking about healthcare overall, we have doctors, we have medical assistants, we have nurses, we even have those hospital assistants, and also even ambulance drivers, right?
Yeah,
so basically, number one, remuneration is definitely one of the important factor. Okay, and we must understand what are the areas of the push factor. More than the pull factor, the push factor is very important. One is remuneration. We may not be able to give as high as Singapore, fine, it's okay. But are we giving enough for what they are delivering? That's number one. Number two, is there a very clear career pathway? If a doctor enters a housemanship and goes to medical officer, he or she, are they very clear where can they apply, what do they get? Career pathway is very, very important. And number three, promotion. Okay, if they get promoted, if you're from a specialist, you know, they have the grading, the government system, JUSAs, and then you go up the ladder. So it must be very, very clearly defined. There must be transparency in that part, and including posting. There are certain things the government has come out, right? Posting. If they are married, and suddenly they get posted another place. So these are the basic things that we need to address it, so that many of them, they live to work, but the environment must also be conducive. The career pathway must be very clear, promotion must be very clear, and then the fair remuneration must be there as well.
I know these are long-standing issues in the healthcare, in the public healthcare system, particularly amongst the public healthcare workforce. Are you encouraged by what you see in terms of progress? Because, I mean, I've been doing this show for quite some time, and post-COVID, we have discussed multiple times what can be done to alleviate some of the pressures on the healthcare workforce. Are you seeing any progress? Are you seeing any movement in improving?
Of course, to be fair, of course we do see some movement, but the issues that rising up is becoming worsening compared to the progress, right? So that is why what is important for us to understand is that healthcare is a whole of nation and whole of society approach. It is not only the role of the Ministry of Health. The other ministries, for example, if you look at the placement of staffs, is under the JPA, Public Service Department, right, under PM. And then you have Ministry of Finance also under PM. So definitely the Prime Minister has a very important role to play to ensure the sustainability of the healthcare system. So it's not fair to always to push the Ministry of Health, because the Ministry of Health is just receiving, and then they have to execute, and the pressure and everything is fingers pointed to the Ministry of Health.
Yeah, they do get a lot of flack, don't
they? Yes, so to be fair to them, I think with lots of constraint, underfunded, understaffed and overworked, and I would say they're delivering. So today if you're having a long waiting period, the government should collectively, the cabinet should collectively, and since the Prime Minister, 2 portfolios under him, so Yang Amat Berhormat has to look at it very seriously, because why? We can see Singapore. Right? I'm not promoting Singapore's health recruitment. We can see that I saw a few days ago they're looking at 15,000 healthcare workforce by 2030. We can see how aggressive they are in recruiting. So how aggressive are we in keeping our workforce and in making sure the push factor is minimized?
Right.
How can we make sure that not everything you need money? Promotion, it must be very clear. Your career pathway, you must be very clear. As a young doctor, at the age of 20s, they spend 5 to 6 years in medical school, then 2 years of housemanship, and then 2 more years as a medical officer. Then they go into specialty. So in a person's life, the 20 to 30 years is a prime time.
Right.
So this generation, this particular age group, they want to have a very clear mindset. What is the career pathway? Are we providing that clarity in them? Do they know, if I want to be a surgeon, is my career pathway is very clear? Okay, so that clarity must be there, and for you to do that, you don't need money.
That's right. Yeah.
You just need ideas. You just need transparency, and then the manpower dashboard, the distribution. MMA has been asking the ministry to publish it. The distribution of workforce.
Refresh my memory. So the dashboard would be how many doctors are at which region, which place. Okay.
which hospital, in terms of specialty, medical officers, nurses, the MAs. So all these things must be mapped out so that it's more and today with the digital era, technology, you have all the data, right? And our decision must be data driven. So that is why what I'm telling is that it is not purely the Ministry of Health. Okay, we must also make sure the government, the Prime Minister, in two important portfolios are directly under him. Okay, so definitely the Honourable Prime Minister has to take this issue very seriously.
But there's been a lot of discussion about the reset agenda, right? Reform in the healthcare sector. Recently, the Ministry of Health, actually Bank Negara to be quite precise, Bank Negara released a white paper proposing a base medical health and insurance takaful plan. So allowing for the people who are not covered by insurance or cannot afford the premiums of insurance to have an option of a cheaper premium or insurance coverage. So that's being positioned as one of the reforms in the healthcare sector. I'm curious to know what you think of it. There's been a lot of conversation about whether this is well designed or not going to be enough to address the real issue of medical inflation.
Okay, I think one thing we need to understand the behind the MHIT. Okay, number one, of course, the issue one was that the rising in the premium and the medical inflation in the private healthcare. Okay, so that is how, to be fair, the first time Bank Negara together the Ministry of Health and Ministry of Finance and also other stakeholders, MMA is also part of the Jawatan Kuasa.
Consultant?
Jawatan Kuasa bersama, you see. So definitely the idea was that to address that particular issue of those who already taken the insurance, because many also have dropped out because they cannot continue their premium, and also those who want to take it up. So it's totally to resolve certain issue that was raised. Okay. So obviously it is a good move. It is a good move to address that particular issue. But of course, with the support of Bank Negara, of course, when the regulator comes in, and then we can see how serious they are to look at that. I mean, to be fair to the government, at least on that part, I think they are doing the right thing. That is only for the private insurers. Okay, it's not for the national health, yeah?
I understand. So this is an option for private insurers to offer this base plan. So allowing people who, as you said, have, lapsed or dropped out from their insurance coverage because of the rising premiums. Are you concerned in any way about this, that it might not achieve its objective? I think my question is, what needs to happen to make sure that this great idea is executed and achieves what it hopes to achieve?
I think what is important is that, of course, the intention is very good, to be fair to them, but also we have concerned those who are above 60 years old, and of course the fine print when the policy is out. But the good part is that at the moment the government is looking into getting more feedbacks. Okay, up to Q2 they're still going to get feedback, and there's going to be a POC as announced by the minister. POC towards the end of this year, and also it will be only launched next year. So definitely there's a lot of room for improvement because the government is getting feedbacks, and this is the first time they're doing that, to be fair to them. So definitely we have also raised some of our concern, especially those who are about 60 years old, and then what about the exclusion list, and also they must be very clear in terms, there should not be any hidden exclusions, those with the sick, So we want it to be very transparent, and also the coverage in terms of the diseases, it must be very clear, and then they should be very clear about the premium also the next couple of years. We should not be in the same situation in another 5 years until the premium goes up. There shouldn't be another policy to coming out. So this is very important for them to ensure that these things are also addressed.
So really it's in clarifying the details, making sure that the details are right, but also in tweaking the design so it achieves what it hopefully is intended to achieve. We've been talking a lot about reform, and I think a lot of the focus has been on treating illnesses and less on preventing illnesses, early interventions. I want to talk to you because you yourself are a practicing GP. So I am curious to know about how we can reorient our healthcare towards primary care, preventative and primary care.
I think the most important thing, Melisa, if the government really is looking into the long-term solution for medical inflation, number one is to strengthen the primary care. This word about strengthening primary care has been spoken about many years. and it started in 2015. They call enhancing primary care. After the government engaged a Howard group to do some studies, right?
Yeah.
You know, our country is very good at engaging external consultants to do a lot of studies after studies, right? Like what you rightly said is execution. And then we had this health white paper that was passed in the parliament by both political sides, right?
Yeah.
So the 4 pillars has already been clearly defined, and one of it also to strengthen the primary care.
In the white paper?
Yes,
Okay.
yes. So now looking into that, so we see our resources. So we have close to 10,000 plus GP clinics in the country.
Oh, wow.
And then you have another 2,000, close to 2,000 clinic kesihatan and also clinic desa in the country. So from here we know we have 10,000 plus GP clinics well distributed throughout the country based on the population demographic. So how do we leverage this particular resource that we already have? The government underspends in the public sector, right? So at least the private sector has the infra, and they also have the manpower. So it's the time that if the government, what they should do is that they should start looking into outsourcing certain things to the private sector, so that the clinic kesihatan, they can focus into more complex cases, so that their resources are not overstretched. Like for example, National Immunization Program. The GPs has been involved in immunization since independence, right?
Yes.
And then during the COVID-19, we did a fantastic job. Okay, we did a fantastic job. So these are the areas where they can outsource to the government, outsource to the private sector.
Yeah.
And then also based on the Colico PC study done in 2015 as well. And they clearly mentioned that the public sector focusing more complex cases and more wide services, whereas GPs, they're focusing on acute illness and also, but they're able to give personalized care because the family doctor concept, right?
Talk to me about that, the family doctor concept. So before our interview, I did a kind of an anecdotal survey about how many people still practice having a family doctor. And not a lot, I have to say. Is it still achievable, sustainable, or even desirable in this day and age to have a family doctor system?
Okay, that's a very good question, because if you look at today's era, right, especially in an urban
setting,
fast-moving area,
yeah,
right, we can see a person, they'll have, what do you call it, a doctor at the place where they stay, and they'll have a doctor at the place where they send for babysitter, and then they'll have a doctor at the place where they work, and then they'll have a friend who's a doctor, and then you have online doctors, or anything you Google and check, right? So this is the reality, and we need to accept the fact that this is how the current generation is going to behave. Okay, but having said that, what we have noticed in most clinics, even in a study done by MMA in 2018, right? So we have seen 60% of the patients visiting the clinics are family unit. I mean, they come as a family, and most clinics, this is a small study we have done in the private groups. Almost 70% patients are repeat patients. So there is a demand for patients who are looking for the same doctor,
right,
because why they do not want to repeat the same thing to somebody else, right? So definitely the concept is there. But now the question is that most patients are coming because of acute illness. But if we pivot it more towards enhance the private GPs to manage long-term cases, like for example NCDs, so definitely they will come to us. So the policy also must be very clear. So the policy must be clear, the system must be clear, so that the government can actually leverage and optimize the GPs in the country.
Can you talk to me more about that? What kind of health services could be outsourced to GPs beyond immunization? What are you hoping, how are you hoping to that the government empower GPs to help strengthen preventive and primary care?
Okay, number one, the GP's role is, one is preventive, promotive.
Preventive and promotive.
Promotive.
Okay.
That is where you should invest, because the earlier you catch something, you are able to address it, right?
Right.
So under the preventive, we can do screening. We screen. So when we screen, like for example, PKB40, it's a good initiative by the government. Then you have SOCSO screening, right? You screen. So what's next? So it's important to have continuity of care, right? So now what's next is that if this patient is under the B40 group or can't afford, we just refer them to clinic kesihatan. So what the government can do is that they should allow the GPs to manage the NCD cases. We only refer to them okay, when it's necessary based on the clinical guidelines.
What does that entail, manage NCD cases?
Okay, sorry, managing diabetes,
Okay.
hypertension, cholesterol, even obesity. So this can be managed at the GP clinic. Okay, so the government should sit down together and see how they can outsource to the GPs.
Is it not currently managed
No,
with GPs?
we are only doing, no, basically those managing is either out-of-pocket patients, that means they pay on their own,
I
or it's a
understand.
corporate client. So what we are telling is that we see a big pool going to the hospital, clinic Kesehatan, right?
Yeah.
So the government can actually look at the numbers and look at the mathematics, and then they can say, hey, why don't we do outsourcing? And this has been spoken about for more than 20, 30 years.
Oh, so it's not a new
It's
idea.
nothing new, it's nothing new.
So what's hindering this from maybe moving
I
towards
w- I-
outsourcing it?
Yeah, I would say what we need in execution is political will. There must be a strong political will. I am going to execute this, that's number one. Okay, the will must be there. Yeah? Of course, the next is funding. So the government just have to calculate and see, to roll this out, how much will it cost?
Could it be expensive, Dr. Rasu?
I don't have the exact figure now.
But do you think it is?
It should
Is
not
it something
be.
feasible that could be
It
done?
is definitely something feasible compared to the amount of money we are spending when they're going into illness and also
Exactly.
complication, right? So we put the most money in the hospitals when somebody is already into complication, but what is the outcome? So why can't we focus more into the primary care, strengthen the primary care, and then today with digitalization, you can monitor health outcomes.
Well, you talked about, you used the phrase continuity of care. And is that hindered by the fact that we don't have kind of digital records that can follow a patient from one, one GP to another? So there can be continuity of care.
So of course, at the moment, we all work in silo. Private sector, whether GPs, among the GPs and also GP and hospital, we work in silo.
Silos, yeah.
Government clinic, clinic kesihatan within each other, and clinic kesihatan with the hospital also working in silo, right? Okay. So we have a lot of silo. Then Ministry of Defence and Ministry of Higher Hospital, I mean the like UKM, PP, UKM,
Okay.
PPUM, so on and so forth, right? So basically, of course, so we are aware that the government has done, they have actually digitized many of their clinic kesihatan, to be fair to them.
Yes.
Okay, they have done that, and then the records they're currently sharing with the patient through MySejahtera, which is very commendable, and also at the reset meet at the Jawatan Kuasa last week when the minister announced, they're also looking into sharing of data, of starting from imaging. So these are all good ideas. To be fair to the Ministry of Health, they are doing that. Okay, we can see there's a progress from the Ministry of Health with the limited resources. They are doing all these things. Okay, so definitely certain things we are on the right direction. Okay, but we must do it fast.
Okay.
But our concern is that in the last 5 or 6 years, we are worried about it should not be a political cycle. You see, healthcare is a marathon. There must be continuity. We do not want a new political cycle comes in and then a new narrative goes in. Okay, so it must be very clear. So health paper was passed. It's good the current minister is following some part of the health paper elements or the pillars to do that. So it must be a concerted effort, because for healthcare you must have a clear direction.
Yeah.
You must plan it next.
It's a long
yes,
game, isn't
in
it?
next 10 years, mid-term, short-term, mid-term, and long-term plan must be clearly planned. Manpower, your facility, mapping, all must be done. Then, so that whoever comes, whichever government comes in the future, they just have to carry forward. And healthcare should not be politicized. That's very, very important.
That is a real concern, isn't it? Especially if you are concerned that reforms are not fully implemented, not fully institutionalized yet, that there could be changes with the political cycle. So something to be definitely cognizant of. I'm curious to know, so one of the things that we had spoken about with making sure that primary healthcare is invested in, is given the opportunity to help relieve or alleviate some of the burden that being put on public healthcare. Is there anything you would like to see in terms of prioritization with primary healthcare, particularly with GPs? There's a lot of conversation around GP fee structure, regulatory caps, and all of that. How do you see GPs fitting into the national reform for healthcare? Are they being sidelined or neglected or forgotten about?
I would say, yes, you're correct. Okay, I know I'm on TV. I have to tell that that's what is happening, because we have been speaking about this for many, many years. And some of the, you see, your policy direction must be very clear. Okay, even the governance structure, if you look at the Ministry of Health, the governance structure itself, right? Under the Deputy Director General, you have 4 Deputy DGs. So there's one under Perubatan, then it goes under Perkembangan, Amalan, and then CCAPs. So the focus more towards regulating the practice of the GPs. And then you have another Deputy Director General under Public Health. Then under that only comes the Klinik Kesihatan. So where do we stand? Okay, because the Ministry of Health is the ministry for all. Not only for the public health, it's also for the private sector. For the private sector, the policies must be to facilitate us. Okay, if let's say we're opening up a clinic, so the regulatory burden, they must ease the regulatory burden. How can they support in terms of developing the practice? Okay, we're not asking for money, clear policy direction, how they can assist. A simple thing, how can they map GP clinics to the Klinik Kesihatan and also the public hospitals? Okay, because we play a very important role.
There should be some kind of synergy,
we
right?
see hundreds of thousands a day, the whole country, right? So imagine the amount of burden we're taking in the government clinic with our own funding. Okay, there's no burden. Those who are doing very well, they pay taxes as well.
Yeah.
Right, so that's why it's very important. If you look at countries like Australia, even Singapore or UK, they know that it's important to strengthen. But here, you have resources available, including your consultation fees, right? 33 years.
That's right.
Okay,
It hasn't been changed for 33
but
years.
But the minister has announced that it will be done soon.
Hopefully.
But we know he's working very hard on that. Now he's on administrative issues. Should be done.
Dr. Rasu, I've lost track of time and we've got a minute left, and I do want to ask you what your priorities would be as MMA president this year. It's a short tenure, it's 1 year, isn't it?
Yes.
Are you hoping that you'll be able to achieve something during 2026?
I'm very confident. I think what is important is that even though our tenure is 1 year, but this is a continuous struggle that all the previous presidents has been pushing. So we'll push, and of course some of the things that we are looking at, we are quite confident of the GP fees.
Okay, this year,
GP
hopefully.
fees, this year.
Okay.
I'm hoping this month or next month.
Oh.
Okay. Then we're also looking into the workforce. For the government side, we're also looking into the workforce. For example, we've been pushing for the incentive for those who are traveling to Sabah, Sarawak. We've been pushing that, right? So we are disheartened, and you know, it's 4.2 million a year. Our assumption, compared to the amount of wastages and corruption that's going on in the country, is a small money. And is how do you appreciate your workforce? Yeah. Okay, so I think we want the government to understand that this is something they will continue to fight for. Okay, and then we believe not only the doctors, the entire healthcare workforce, in the public sector, they deserve this recognition. And for the private sector, the government should also acknowledge and make sure that the policies are very clear. And also we will strongly continue to advocate to the public as well, because healthcare is a whole of nation and whole of society approach, and healthcare is everyone's responsibility, including you and myself. Okay, we cannot just outsource it to the government.
Absolutely.
But our job, we make sure the government's responsibility to ensure the system is in place.
Dr. Rasu, thank you so much for your time. That's all the time we have for you on this episode of Consider This. I'm Melisa Idris signing off for the evening. Thank you so much for watching, and good night.